I mean, it's not like they were doing brain surgery or something. Actually, that's exactly what the doctors were doing. Doctors at Children's Hospital in Boston actually performed brain surgery on a baby. But what was unique, the baby was still in the womb of the mother, and they performed brain surgery. The baby was diagnosed with something called a Galen malformation on ultrasound. What's a Galen malformation? It's a malformation in the brain where you have a high pressure artery that has a little connection with a low pressure vein. And it's bad. It expands the vein and blows up the vein and carries too much blood back to the heart, and the baby can go into heart failure and die from this pressure gradient difference. It's kind of like if you were trying to blow up your kid's water balloon, but instead of just using the faucet, you decide that you're going to use your pressure washer instead. It's not going to end well. When these babies are diagnosed and then deliver, half of these babies get really sick. And of those babies that get really sick, half of those babies die soon after delivery. So the doctors at Children's Hospital in Boston decided, why can't we fix this while the baby is still on the inside? So mom was given anesthesia, and they made sure that the baby was facing in the right direction with the baby's head facing down. And they went in with the needle, guided by ultrasound, through the skin of the mother, through the wall of the uterus, and they took that needle and they went right up to the occipital area of the baby's brain. They went through the skull and went right up into that big venous sinus, and they occluded that connection between the high pressure artery and the low pressure vein. And guess what? They delivered that baby 2 days later. The baby needed no additional therapy, no additional surgery, and that baby is doing beautifully. If we can treat the preborn as patients in the womb, then they have rights. A patient is a person, no matter how small. We are now doing open heart surgery. We are doing laser vascular surgery. We're doing blood transfusions. And now we are doing brain surgery on babies on the inside of the womb. If they're a patient, they are a person, and they deserve our protection because they have rights. If you have any questions, you can contact me through my website, which is prolifedoc.org. God bless you and have a wonderful day.